one of the most controversial moments of the pandemic when the Prime Minister's chief advisor, Dominic Cummings, drove over 250 miles from London to Durham during lockdown.
Senior NHS doctor Dominic Pimenta threatened to quit unless Mr Cummings apologised and resign. Here's a reminder of what he said.
Everyone's done their bit. Dominic Cummings has not. I cannot countenance a system where such flagrant disregard of the rules would be risked for the sake of an apology. It is incredibly insulting to myself, to all the NHS staff.
You're prepared to finish your medical career because of what's happened here?
Yes, and I think we all have to draw a line somewhere.
Well, Dr Pimenta kept his promise. He resigned from the NHS. He's since written a book about working on the NHS frontline during the pandemic. He joins us now from North London. Good morning to you. So you took this decision, you've made the decision to resign. Do you still stand by that? Do you have any regrets over what happened?
I mean, absolutely. And I think the book gives a lot of context to the last 6 months. I found myself across many parts of the pandemic, from not just working in COVID ICU, but before that, calling for early lockdown and also setting up a £1 million charity to support healthcare workers. So a lot of the pandemic was very personal to me, and all the royalties from the book, by the way, go to that charity. The decision to resign was not so much over what Cummings did, but the government response to it, which I think was the real key. The fact that they were, as I said in that clip, and I'm embarrassingly wearing the same jumper, that it was the unwillingness to apologise. Lots of public figures did the same thing, but they apologised and upheld the importance of the lockdown. And again, in the book, you get the narrative that actually for us, you know, the lockdown was a real tangible thing that came and saved many, many, many lives. And we saw that firsthand. And part of the reason for writing the book really is to relay that message, almost as a thank you to everybody who did follow the lockdown rules and they didn't break the rules and saved many lives in that respect. And maybe that was hidden from a lot of people because they weren't inside hospitals or ITUs like we were. And unfortunately, the government went a different way and they undermined that. And in a time when we've lost over 600 healthcare workers, over 50,000 men and women in this country to COVID, that was unacceptable to me. And as a consequence, I resigned.
Dominic, no one can argue with your frustration and your anger at that time. A lot of people were furious. And of course, the reaction that you had, I think is very understandable, that frustration leading you to want to step down. I know you're serving out your notice period now, but you trained for 7 years to become a doctor. That's a lot of hard work. My brother is a doctor as well. I know what you go through. I know what your family go through. And then you're on the wards, and then you're doing all those hours and hours of work and hard work on the wards. Has there been a moment when you thought, I can't leave this. This is my calling. This is the job that I was born to do. I absolutely love being a doctor. I love being a part of this.
I mean, and again, I sort of write a little bit about the background of where I've come from in terms of being a doctor, and I grew up in a very sort of white area on the south coast, and actually I think medicine for me was a sort of tribe really, and it's something that's such a core part of who I am as a doctor. I think, you know, the importance of the resignation was to change that national conversation and to underline the importance of the lockdown and to save lives. And there's a wider duty, I suppose, as a doctor to the public in a pandemic specifically, to that public health. Whether or not in the future I come back to being a doctor, I don't know. But I'm currently, as I said, serving out my notice, and I worked the last 3 months in intensive care, and my last shift, thankfully, we discharged all of our COVID patients. So in that respect, served out some time there. And now in my role as the chairman of our charity Heroes at helpthemhelpus.co.uk, I'll actually probably be doing a lot more to support the NHS across healthcare workers. We've delivered about 500,000 items to healthcare workers over the pandemic, and then looking to see what happens over the winter to see what kind of support we might need to be offering then.
Do you feel, I mean, there are those who would criticise your decision from the point of view that we were in the middle of a crisis. You know, your book is called Duty of Care. It details what it was like working on the front line. But because of the decision you took, you know, potentially you haven't been there as much, or you won't be there to be able to help people. Isn't that, in a sense, abandoning your duty of care?
I mean, that's a fair question. But I mean, as I said, actually, I did give my notice period like you would with any job, and I continued to work in intensive care, which is actually not my job, but that's where I stayed because I thought it would be the most useful up until, well, now, basically. And funnily enough, as I said, through the charity and through being the chairman of an NHS supporting charity, it'll probably end up actually being more effective in supporting the pandemic response in a greater respect. And there was some criticism about, giving up on the NHS at the time, which obviously I know I continue to work through. But actually, it was more about standing up for, the 600 healthcare workers plus that have now lost their lives due to COVID, and the greatest sacrifice in the country that we all went through, and to really underline that importance of the lockdown, and especially at this critical time when potentially looking at a second wave over the winter, and how we keep that behaviour going and continue to save lives. I think it is the greater, the greatest duty.
Hugely important, isn't it? I'm intrigued just to get Dr. Hillary's thoughts on this, Dominic, if we may, because of course you can completely understand Hillary, Dominic's frustration and anger when Dominic Cummings did what he did and wouldn't apologise or stand down.
Absolutely, and Dominic, I think we've been in touch before, but you're not the only one who's expressed severe frustration. There was a Welsh consultant surgeon, who said, please don't clap anymore on a Thursday night for the NHS because there are too many people not obeying the rules, not obeying the guidelines, flouting everything, going to raves, going to parties. And, of course, what we're seeing now is an increased rate of transmission, and everybody very worried, like you and I, about a resurgence of the first wave, perhaps a second wave this winter, combined with all the seasonal viruses and bacteria that come our way. So I think the point you make is very valid, and you're doing great work in stepping aside from the frontline work and doing the work that you're doing now. Yeah, clearly the charity is going brilliantly. You've raised over £1 million, which is extraordinary. And this book, I just want to say this again, Duty of Care is Dominic's book, which is out now, and all of the proceeds and royalties from this book will go to that charity. So undoubtedly you're going to carry on having an impact, Dominic. It's really good to see you this morning. Thanks very much for joining us. And we like that jumper, so we're happy that you wore it again.
Yeah, thanks for wearing your favourite jumper. We appreciate it.
My GMB jumper.
Your GMB jumper, that's it, will forever be known. Good to see you this morning.